Hello, good to be back again. Today, I'm going to talk about metatarsal fracture, especially fifth metatarsal fracture. Why I choose this topic? Because there's a question from our friend. She's very specific. She asked me to talk about fifth metatarsal fracture. Thank you for your support, and don't forget, please like, follow, comment, and share this channel to propagate the knowledge. Okay, before I start, I want to show the anatomy of the foot. This is a right foot, ankle, right ankle. This is tibia. This is fibula. Inside, there's a bone here, talus. And then, where is the metatarsal? This is metatarsal bone. First metatarsal, second metatarsal, third metatarsal, fourth metatarsal, and fifth metatarsal. Today, we are going to talk about this area. Fifth metatarsal area. Okay, can you see? I label the metatarsal as number 1, number 2, and number 3. There are 3 zones over the, we call proximal area of the metatarsal. You can see there's zone 1, zone 2, and zone 3. This is very important. Your doctor, orthopedic surgeon, they will recognize this area because each zone, if involved in fracture, will have a certain or specific consequences. You can see the zone 2. This zone, if there's a fracture line within this zone, it is called Jones, Jones, Jones fracture. And over the zone 1, it is called avulsion fracture, and zone 3, stress fracture. So today, we are going to talk about the zone 2, which is Jones fracture. Jones fracture is very special because if it is involved in fracture and then the fracture is displaced, the risk of non-union, it means the bone will not unite or not healing, is high. Why? Because of the blood supply. There will be a disruption of the blood supply. Why? This blood supply comes from proximal area, meet over the zone 2, and another blood supply comes from distal area. They will meet at zone 2, called watershed area. If it is fracture, there will be a disruption of the blood supply, which predispose this special fracture to non-union. So how do we treat? Before that, most of the time, the patient involved in inversion injury of the foot lead to fracture. So how we diagnose? Normally, diagnosis can be made via plain radiograph or plain x-ray. And then the surgeon, orthopedic surgeon or doctors will locate the fracture line, whether it is fall into zone 1, zone 2, or zone 3. If it is fall into zone 2, most of the orthopedic surgeon, they will counsel patient to undergo surgery. What type of surgery? Open reduction. If necessary, we need to open the area, reduce the fracture line, and then put a compression screw. This is how we do compression screw. Okay, why we need to do compression screw? Because we want to compress the fracture site in order to achieve healing. As I mentioned earlier, this type of fracture have a high risk for non-union or non-healing. So again, most of the doctor will recommend for surgery. Then the patient will ask, is there any role for non-surgical intervention for Jones fracture? Definitely, we can try non-surgical or conservative management for this type of fracture with cautious. So what we do? We put a below knee cast, then we will inform the patient to avoid weight bearing with crutches support. So how long? It will be around 6 weeks with serial radiograph examination or serial x-ray examination to look for any progression of healing during the non-surgical intervention. If there is a progression of healing or non-union, definitely good for the patient. We will off the cast at the 6 weeks and then allow weight bearing, and he or she will go for physiotherapy to get the normal range of motion of the ankle and the foot, and then after that followed by muscle strengthening. And the last part of the physiotherapy or rehabilitation will be specific activity training. In case there is evidence of the fracture is non-progressing or there is evidence of non-union or non-healing of the fracture site, then we will advise the patient to go for operation, which is compression screw fixation over the area and KIV bone grafting. Why we need to bone graft? To increase the nutrition or blood supply to the fracture area, and with the aim to stimulate healing, because there are a lot of growth factor inside the bone graft, and this with the hope to achieve union or complete healing over the area. So in summary, Jones fracture, high risk to get non-union. The doctor will advise you to go for surgical intervention, which is compression screw. This is to achieve union. An advantage of surgery is the patient will have a faster rehabilitation and faster return to work. Again, non-operative or conservative treatment with casting and non-weight bearing also have a role in Jones fracture treatment, but you must undergo close observation with serial x-ray to assess the fracture healing. In the evidence of non-healing or non-union of the fracture, the doctor may suggest for you to undergo screw fixation. And after this procedure, rehabilitation is a must, and to improve the range of motion of the ankle and foot as well as the muscle strength of the involved area. Of course, patient as average, they will return to work or return to sports at the second month or third month after injury. Thank you. I hope this will able to help you all to understand John's fracture. Thank you.